Hi, good morning, everyone. I'm Julie Reynolds, as she said, with the University of Missouri, Kansas City. I'm with we're a University Center for Excellence in Developmental Disabilities, and we also have a federal No Wrong Door grant we've been working on in Missouri for about the past year and a half to really help support people in staying safe and in addressing the COVID crisis. Okay, I'm going to apologize because I don't know how to make the slide go forward.
Look to your left.
Sorry, everyone. I'm new to WebEx. So what we're going to start out with here from UMKC is we're just going to want to talk a little bit about going back to the basics of kind of what's going on with COVID and kind of how we start addressing some different things that will help the people you all support, and really just thinking about how do we speak with people about their health and safety? How do we help them really understand what they want to have for their good life so they can maintain their health and safety? You know, how to kind of look at those things, and then how to really think about too what is important to and important for. So I'm going to play a short video, and hopefully everyone can see that. Just about, as we say here, getting back to basics. Can people hear that?
Julie, you need to share it again.
Okay. Can you all see that now?
Hopefully everyone can see my screen now. Good morning, everyone. I am Carrie Williams, and I am the TCM TAC State Lead. And in the next couple of slides, we're going to talk about the role of the support coordinator. One of the roles, as we know, of the support coordinator is to connect individuals with integrated supports and services. The support coordinator assists in providing the individual with an array of resources which meet the needs of that individual, and to provide them with information about topics that might be important to them. So in this presentation, we'll be reviewing information that will assist the support coordinator in their efforts to share current information and resources pertaining to COVID-19. We know that individuals with intellectual and developmental disabilities are considered to be at high risk for severe illness and poor outcomes from COVID-19 infections. And so we are hopeful that this information may assist the individual, their family member, and guardians to make informed choices and decisions. Support coordinators will be provided a COVID-19 toolkit that is designed for individuals, families, and caregivers. And that toolkit may be utilized to support them in making individualized decisions during the COVID-19 public health emergency. So a good time to share this information is during your next monthly or quarterly monitoring visit, just whenever that next monitoring visit is scheduled. So the sharing of these important resources during the COVID-19 pandemic, it's an important effort that you're doing as a support coordinator. And while documentation into the division's integrated quality management functions database, or as we all know it, IQMFD, as that is not a requirement for this process, it is a method for you to note your efforts as a positive outcome, that you're sharing those resources. When entering into IQMFD, the following process is followed. Of course, you would be entering that under QM source of service monitoring. That domain would be positive outcome. The category is healthy living. And then a new type has been added, and that new type is this COVID-19 resource vaccine information shared with individual and caregiver. And then you may also highlight in the summary if you want to provide additional information, such as specifically information that you shared. So I am now going to turn it over to Leslie DeGroat, and she is going to review with you the information that will be available to share. And the following information that she will be covering, it's a toolkit with information pertaining to the COVID-19 virus and measures to help keep individuals healthy. The information is intended for support coordinators to share with individuals, their family members, and their guardians. So I will turn it over to Leslie now.
Thank you very much, Carrie. Hello and good morning. I'm Leslie DeGroat, and I am a registered nurse, and I serve as the Division of Developmental Disabilities State Clinical Coordinator. Our division team, along with our colleagues at UMKC, Institute for Human Development, work together to develop this toolkit. And as Carrie said, it does provide an array of resources to assist with meeting the informational and resource needs of the individual. I'm going to share the toolkit on the screen, and we will go through it together so I can show you what kind of resources you will have and be able to use to share. Okay, hang on a second. All right, there we go. All right, here is the toolkit. I'm going to move something over on my screen a little bit. Okay, it says at the top, COVID-19 information and resources. And so we're going to now discuss the COVID-19 information on this 2-page document, and this is what we're calling the toolkit. It'll have all the tools you need for just a variety of different things that the individual caregivers and families might want to learn about, or you might need some resources. It is important to emphasize that you are sharing information with the individuals. We're, giving them the information so that they can make the choice. The information is intended to assist with making important individual informed decisions. It is important for the individual, their family members, and guardian to communicate with the individual's healthcare provider or other medical team member regarding questions that they have when making these individual informed decisions. Okay, well, we will go through the informational toolkit right now. And let's see, as we look at the toolkit, you will see on the left column the different icons that represent what each type of information, like which each section kind of information it contains. The first section looks like a little person reading and represents general information. You'll be able to print these different items off to share with others, or share by clicking on these links to bring up information on a smartphone, tablet, or computer, depending on what the individual or what people may have. So I have already pulled up the different links because my computer connection is a little slow and I wanted it to work properly for this presentation. So I'm just going to go ahead, this first link right here for Centers for Disease Control, I'm just going to go ahead and show you what is on that. And it is from the Centers for Disease Control, or everybody calls it CDC, and it has easy to read COVID-19 materials. And these materials are primarily for people with intellectual and developmental disabilities and others who want basic information. You can see that the wording in blue are also links that will bring up information pertaining to that subject. So if you click on, like right here, the spread of COVID-19, it will take you to information as to how COVID-19 spreads. So you can read down there and it's just real plain statements like COVID-19 can spread easily, COVID-19 can spread between people, and it gives information like that. It may get on your hands. And then right here, stop COVID-19 every day. And it talks about stay at least 6 feet away from people outside your home and different tips like that. And just a real easy language kind of a presentation here. And if you want, you can always download and print. So if you click on that, so you'll have a downloadable copy if you want to share that with someone. Go back to that. And then there's also a little spot up here where it says print. So you can print it off that way as well. So that might be convenient for you too if you go out and about bringing something like that along. I mean, it just kind of depends on what your individuals need and what would help them. Okay. And the second link we have here, CDC. From the CDC, it's vaccines are important. So I will go and show you that. So COVID-19 vaccines are important. And this is similar to the other one. It's easy to read information regarding COVID-19 vaccines. And it just gives some general information about it that's just, just real plain. Their COVID-19 vaccines are free for you. People can get a COVID-19 vaccine in many places. And then, just kind of tells a little bit of details about it. So now we will look at the next link. And this is a really neat, this next link. It's I'm going to go ahead and show it to you, but it was developed by the Missouri Developmental Disabilities Council in partnership with the Missouri Department of Health and Senior Services. And it's called the Missouri Plain Language Guide. And it's COVID-19 vaccine for individuals with intellectual and developmental disabilities, their families and caregivers in Missouri. And I just love that picture on the front. I think that's so sweet. It talks about choice, as you can see right here, the first statement, because it's about choice, but we want to give them information so they can make a choice. And our resources are from reputable sources. Here it says COVID-19 vaccine of eligibility, where to access, talks about the disease itself. How do you get COVID-19? I like the little illustrations too, that kind of helps. And that shows there where your lungs can be affected. What happens if you have COVID-19? How sick can you get with COVID-19? How can you stay healthy or not get COVID-19? It shows all the basics, back to the basics, This I like right here. Make a plan in case you have to stay at home. So if an individual, in anticipation of the possibility, they may need a little bit of assistance. So they may want to figure out a plan for in case they can't get out and get groceries, or maybe they can't go to their job. So it kind of gives information about how to deal with that. And then where can they go safely? How do they keep in touch with their friends? The importance of it, just a brief sentence there. What do I do if I'm sick? And then what do I do if someone I live with gets sick? That's, that's something that I think a lot of people are concerned about. And then, so that's that. It's a eight pager, but it's got a lot of good information on it. And then there's the mostopscovid.com website, and then the moddcouncil.org website on there for reference. Okay. Now the next two, the final two links in this section are for informational documents that were created by the Missouri Division of Developmental Disabilities and are called Observe, Decide, Act. And we have ones for different kind of health issues, and we made one for COVID-19 that's got general information on it that can also be used. I mean, these are all things that you can choose and see what best meets the needs of the people you are serving. So these are just a whole bunch of options that you can have. And then here, information leads to knowledge. Knowledge leads to the practice of prevention. The practice of prevention promotes health. So that's kind of the motto for these. So under Observe, it talks about signs and symptoms, people who are higher risk of getting very sick. And there are links embedded in these documents talks about older adults, people with certain medical conditions, and then not vaccinated. We have a statement in there for people who are not vaccinated, how to avoid getting sick. Because not everybody can get vaccinated, not everybody chooses to. See how to support individuals, talks about good hand washing, sanitizing, or actually it's more like environmental cleanliness, social distancing, and act. Okay, if diagnosed, what do you do if you're having symptoms? What do you do if you're diagnosed? And then this is a huge thing, as we all know, how to cope with anxiety related to COVID-19. People's mental health we have to keep in mind, because it is a stressful time for everyone. And especially if someone has to be quarantined, or if they're sick and not feeling well, or maybe someone they care about, they can't go see them or do regular activities. It gives some brief messaging here. And this CDC has a link for resources with coping with stress. And then also our DMH Office of Disaster Services. This link right here, if you click on it, it has different things that could help with coping with stress and taking care of your mental health. And then on that document, we have the reputable sources and then our references to where we exactly got the information. So the next, I'm going to just go straight for it, but it's on the toolkit. The next one is a resource on pulse oximetry and COVID-19. This talks about how a person can monitor oxygen levels using a pulse oximeter. And that's one of those little things, like a little clothespin that you clip it on your finger, and you could read the oxygen level and your pulse. Now, this document gives you information on what regular oxygen levels are, and it should not be your primary or the person's primary method of monitoring themselves or someone else, but it's a tool, and it can be useful in detecting if someone's oxygen levels are being affected by COVID, and can prompt the person to seek medical assistance. So, once they can work with their doctor on this and say, what should my oxygen levels look like? When should I call for emergency assistance or call 911? When should I call try to make an appointment, what have you? But it's just real brief, and it goes over signs and symptoms of low oxygen, and then what it usually is supposed to run, and then some other resources related to that. And if anybody is ever interested, like I have one that I purchased from just a local store, so it's not just a place where you have to go to a medical provider or what have you to purchase one. But that's just a tool. It's not, Okay, I'm going to pull the toolkit back up. And here we have the next section of the toolkit. You see the little phone over here. It includes phone numbers that can be used for more information. The first part is the Missouri COVID-19 hotline and website, as you can see there. Information on where a person can access a vaccine near them or find information about transportation to a vaccine site. They can go to the Missouri COVID website also, and it's got the website there, and or they can call this toll-free number. But we have the phone numbers on here just in case not everybody has or uses smartphones or computers or what have you. So this is an option right here. If people get nervous or have questions, they can call and hopefully alleviate anxiety and help inform them. Below that is information from the CDC for vaccine help service for people with disabilities. It is called DIAL, and they can help you find, or they can help find where to get a shot, how to get there, like transportation, and with any other questions someone might have. They can be emailed at this email address, which is on the toolkit, or they also have a toll-free number that can be called. And then if the person needs assistance in a different language, there are these two toll-free numbers on there as well. So I'm going to scroll down. And you see on this icon over here, it's movies, TV, music, videos, that kind of thing. We all like to learn in different ways and maybe have a little, it's a little bit something different, not just having to read something but anyway, this third section, many resources are in video form and in a story form. So the first link is from the CDC. I'm going to pull that up. And it is, let's see, it's called COVID-19 Materials for People with IDD and Care Providers. And as I said, it has materials, social stories, pictorials, and videos on staying safe and living with COVID-19. So these are things that if you guys want to share information can utilize if you feel like it will help you. But like right here, this social story follows Izzy as she gets her COVID shot. I'm just going to click on it and show you. But see, it kind of tells a story, which can be, you know, in some cases, it might be helpful to have it kind of like a story. Like my doctor says I need to get a COVID-19 shot. The shot helps keep me from getting very sick from COVID-19. And then it goes on talking about Izzy. There she is with her sister and she's going with her. They're going in the car. Then they're meeting the doctor. Although I think it's usually a nurse that gives the shot. So we have that. Go back to that screen. Let's see. There's also like a video right here, and it's pretty nice. It's pretty short. There's a poster, and then there's an interactive social story, and it uses fill in the blanks and multiple choice options to help a person prepare for getting a COVID-19 shot. So that may be something that might be, you know, you'd want to utilize. Let's see, go back to the toolkit. So this next link in this section has a social picture story in order to get an idea of what you can, oh yeah, we kind of talked about that. So that's what I think I had already pulled up. Let's see if it comes right up. Yep, that's what, okay. So yeah, that's an example of a toolkit or of a story. Okay, I can't see, let's see. Okay, after vaccine, that's what I want to show you. Okay, and then another link will take you to what to expect after getting the COVID vaccine. It has common side effects listed, helpful tips, when to call the doctor, and other reminders, and has a place to put the healthcare provider's phone number down here for a quick reference. Like that person, whoever, maybe you're visiting someone and they're like, oh, that's interesting. I'd like to know about this because I'm getting ready to get my vaccine. Well, you could maybe, if they would like this handout, and then they could put their provider doctor's name right here. And then so if they start having any trouble, they can have that number handy right there. Okay, I'm going to pull the toolkit back up. I hope it's not making you dizzy going back and forth like that. I just don't trust my connection. Okay, this next section is for person-centered planning and has information for people who are assisting individuals with intellectual and developmental disabilities. It has the link to the video that we're going to see from University of Kansas City Institute for Human Development, Back to Basics, and it highlights the importance of individualized support planning. The link for the CDC COVID-19 materials is also on here, and I'll go back to that because I want to show you some other things that you can check out that in case, okay, pretend like it's not just a COVID shot. Maybe they've already gotten the shot or they don't want it. Well, there are also video, social stories, posters, and interactive stories on washing your hands, getting a COVID-19 test, masking, and social distancing. So that may come in handy. And that can even be given to caregivers too, like, or what have you, the link, or you know, however you want to share the information, because that person may want to look it over more than once, because that could help alleviate anxiety and also be an educational tool, you know, just for kind of learning about washing hands and such. Okay, and this next section has the little compass. It's about navigating. So let's see. Has information on where to find testing, vaccines, and on how to access Station MD services. We will start with the one from the Missouri Department of Health and Senior Services to find a vaccine location near you. So I'm going to pull that guy up. Let's see if it's, give me a second here. I can't hardly see. Okay, there we go. So this is the vaccine finder, and this link will take you directly to this page that is on your toolkit. I'm going to scroll down. And as you can see, there's a couple of ways that you can find a vaccine. See, local vaccination events. I'm going to go to that one first. I've already been kind of tinkering around in here. So this will come up. And if you know where your county is located or what have you, like I'm in Saline, so I'll click on that. And it takes me to region, well, it's supposed to take me to region A. There we go. So Bates County, Henry County, Jackson County. It tells that there are clinics. It tells the days of the week. It tells dates and times. And it tells what the location is. So Compass Health, concierge vaccine solutions. So then it talks about under here, walk-in clinic, no appointment required, or you can call ahead. So it kind of gives a little information about how to figure that out or navigate, getting your vaccine that way. And it'll go on to have different clinics in different counties and different cities. This one thing that I really like, here I'm going to go scroll down to clear the bottom, that I think would be most helpful, but that's just kind of my opinion here. But if you go to the bottom of the page, it says federalvaccinefinder.org. Okay, and you can click whatever kind the person wants, which this is just something that a saying that I've heard, and I agree with it, but it's not necessarily everybody's opinion. But the best vaccine is the one that's been taken, the one that you get. So that, you're protected. Anyway, so you can mark all three of them. The person could mark one or two. It's whatever the case may be. Anyway, I'm going to put in zip code here, and then you can put in your mile radius. It goes up to 50. We'll just say 25. It goes even to 10-mile radius, 5 or 1. So if someone's in walking distance, that'd be handy. So we'll click submit. And then it shows all the locations within 25 miles of that zip code. So it shows the place, excuse me, and you can click on it and it'll get you more information on where it is or what number maybe you need to call. Oh, here we go. Okay, I'm hovering over that. So I hover over that, and then as you can see on the screen, it says hometown pharmacy Marshall, and then it's got the address and then the phone number. So if the person wants to call or review additional details, they have that at their fingertips. Okay. So, and you guys will all have all this stuff on your toolkit. So, and you can get in there and play around and look at other things if you want to, certainly. Okay, the next link is in that section is from Missouri Department of Health and Senior Services as well. And it's about COVID testing. So I'm going to pull that up, what this next link shows. Oops. Give me just a second. This thing's a little sneaky. Or maybe I can get to it without. Maybe it'll come right up. All right, and here we have COVID-19 free testing. This is from DHSS. It shows testing sites that are sponsored by DHSS. You can scroll down to see the testing sites, but also you can click on the link at the top that says pharmacies providing free testing sponsored by the United States Health and Human Services. Right here. Oh, that's MoDHSS. Oh yeah, here it is right here. So that can take you to where you can look and see if there's anywhere besides these locations that are in these different areas. Also, if you're ever interested, I want to point out on this page, they just have a lot of information that's really pretty interesting. Right here, we have monoclonal antibody treatment. If you ever want to click on that and check that out, it tells different infusion sites and gives information. That's something that you've probably heard about and you'll be hearing more about. So, because that's something that different states and Missouri included is trying as a way to prevent serious illness and hospitalization. Another thing I want to point out, I'm deviating a little bit, but it's pretty cool and it's on this site. Hotspot advisories. I'm just going to pop that up there. And it shows the dates. And then like this last advisory went out yesterday, and it's Lincoln and Warren counties and surrounding area. And I'm just going to do this real quick. It'll give you just like a little preview of what it's looking like in those areas, and that it's considered a hot spot. That kind of help you guide and kind of estimate, you know, how things are going in your area, and help spread information that way as well. Like if you notice that you're in a hot spot, you might think, "Ooh, I need to probably touch base on this with my, you know, touch base with how to stay safe with some of my, you know, people I serve." Okay, the last link right here is in this section, it will give you information about Station MD. So I'm just going to click on it. I think it'll probably pull right up because it seems like my connection is really doing well today. Okay. The Division of Developmental Disabilities has partnered with Station MD to secure a contract for telemedicine services to be offered at no cost to all Medicaid waiver recipients. It is a telehealth medical service and offers immediate virtual access to high-quality emergency medicine physicians specifically trained in the care of people with intellectual and developmental disabilities. It's 24 hours a day, 7 days a week, and it can act as a resource for individuals, family, caregivers, staff. So if there's a medically related concern about an individual eligible for this service, they can utilize this. This program is in addition to the current medical care offered by each individual's primary care physician. As I said, all Medicaid waiver recipients through the division are eligible, and they're pre-registered to begin using Station MD immediately for any medical concerns. This site gives you information on how to access Station MD and has the answers to frequently asked questions. Like that's a nice, you know, summary of what it does. But in order, like here, you can click to go to Station MD to their site. Right here, information and education, and there's just a lot of different things that you can look at in order to learn more about it. And learn more about how to, you know, people can access it. You know, it's for the individuals and staff, and yeah. It's got some other tabs here with information. So that can be something that the individuals can utilize. Okay, I'm going to pull our toolkit back up. Okay, and in this final section, it's a link to charting the life course, and it's from our colleagues at UMKC IHD. It has a variety of videos that can assist people while managing life with the existence of COVID. As you can see, there are topics. Let me pull that up, because you can't see yet. I have a ribbon that covers the top of it since I'm sharing my screen, and I can't click on that stuff very well. Oh, here it is. Okay. So here we have it. Charting the life course for respite during COVID-19. There's a video, an educational video there. Let's see. If you scroll down lower, supporting mental health during COVID-19, tools for coping and planning during COVID-19, organization supporting staff during work at home. It's got a variety of different things there. Let's see, if you scroll down even lower though, you will see other tools that can help an individual make choices by assisting them with weighing what is important to them and having a balance to keep themselves healthy. The one in the middle can act as a worksheet to help find that balance. I believe they can all be utilized that way, and this will appear on the video that Julie will show. But I wish I could blow it up, but I tried to practice it, but I couldn't. But it's like the person can write what's important to them, and then write what they don't want to happen, and then write or work with whomever and write down just some ways that they can meet their needs and be happy, but also stay safe, and stuff that they're, you know, wanting to do to be able to incorporate all that into their life. So, and that link is on your toolkit if you want to explore that further as well. Bring the toolkit back up. So in conclusion to the review of this toolkit, I want to emphasize that these materials are intended for informational purposes only. Individuals should be encouraged to consult their medical health provider for additional information related to the individual's personal healthcare needs. This toolkit is to help you provide information and resources based on the needs of the individuals. I am now going to turn it back over to Julie from UMKC Institute for Human Development, who, well, we'll see if she can share the video. We'll kind of check the progress there. I'm going to stop sharing my screen.
Leslie, this is Kim, and while Kat is looking to pull that video link up, we did have a question in the chat, so it's a good opportunity for us to provide some additional clarification on the intent of why we're hosting this webinar today and why the division, in collaboration with the UMKC IHD, developed this toolkit COVID-19 information and resource document. So again, just to reiterate, we're asking support coordinators to review this information. It will be beneficial to you as a support coordinator and personally, but then also to take the document as you're conducting your support monitoring, if you choose to do so, and just share this document, hand it over, email it, however you want to disseminate that to the individuals on your caseload so that they can have that information, review it at their leisure, and support them in making important decisions that are specific to their individualized plans of care and their needs related to COVID-19. Support coordinators on the call will be receiving this information. The division will be working with our regional office TCM tax to provide the toolkit document to them, and also some information as a reminder on if you would like to capture your efforts as a positive outcome and IQMFD, how you'll be able to reflect and note that. And so be looking for that information to come out shortly from your regional office TCM tax. And just sharing it once should be sufficient with the individuals that are on your caseload. And of course, if they ask for the information again, you can have another copy and share that with them. So we appreciate the opportunity to do the webinar today. And I'm going to turn it over to Kat, who I believe is going to share the UMKC IHD video.
Can you all see this now? It says staying safe, getting back to the basics.
Yes, Kat, thank you.
Okay, I'm sorry, everyone. It seems like there's no sound. So give me 1 second. Okay, I'm going to try it again. Please let me know if you can hear it.
Kat, I think we're still having some technical difficulties with the sound. Oh.
Help you really get back to focusing on a good life. I want to get started by why we did this, what you're thinking about. And when you're having conversations with people, it's really important to think about what is it that you're wanting to get back to. And when I started out talking to my little brother with a disability, He wants to get back to work and to what he does every day. He wants to hug his friends again. He wants to exercise, maybe go to concerts or go to stock car races. And when I asked him the question, what is it you don't want? He said, I don't want to get sick. I don't want others to get sick. And quite frankly, I don't want to have to wear this mask forever. So that was really our starting point, and something you should think about when you're having these conversations with people. So what do we know when we're having these conversations? It's really important to balance between what's important to the person and what's important for the person. Although we know many things will keep people safe and healthy, it's also important to really balance their dignity of risk and their self-determination. So that's kind of the lens we're starting from in this conversation. The other thing is we always talk about the 3 buckets of support, and how can we use those 3 buckets for staying safe? Think about it. That first bucket is, do people have the information that they need? Are they making informed decisions? Did we give them information in a way that they understand it, in a way that they can communicate? Do we know if that person has someone to talk to that they trust? You know, who is it that they'll listen to? Who is it that will make the biggest impact on them? But we also need to know, how are people getting access to the services they need? Do they have the transportation that they need? Do they have masks to wear? Do they know where to go get the vaccine if that's what they need? So we use those 3 buckets of support throughout our entire conversation about staying safe and getting back to basics. So now let's think about getting back to basics. What does that really mean? Well, we use the trajectory to think about that. So we know our vision for getting back to what we want is going back to work, hugging our friends. And if I sit down with somebody and say, what are the things that might prevent you from getting back to doing those things? The first thing is are you washing your hands? If you don't wash your hands, that might prevent us from going back to being able to get back to the basics of life. If we don't cover our cough or our sneeze, we don't stay home when we're feeling sick, we don't wear a mask if it's needed, and if we don't get vaccinated, these are all things that might prevent us from the vision for what we want and take us towards getting sick, staying sick, and getting others sick. But we can also have that conversation from the reverse. So when I sit down with somebody and I say, what can we each do? What can each one of us do to stay safe? We can think about it like this. Are you washing your hands? Do you stay home when you're sick? Are you wearing your mask? So we use this conversation either way, depending on who that person is and where you want to get started. But it's also really important to think about all of the resources that really help us stay informed about COVID, stay informed about the best way to stay safe. And if you think about it, we use the STAR for doing that. The first way is are we communicating with that person the best way that they know how to learn, the best way that they, do they need it in plain language? Do they need videos? Do they need it in a different language? Do they need a friend or a family member to help them read it and understand that? The other way is who are the people in their lives that they trust? Helping them identify, is it a family? Is it a friend? Is it your doctor? Is it your case manager? Pointing out and helping that person identify those people that will help them make an informed choice. The other thing moving around the STAR is where are you going to get your most up-to-date information? Are you going to the CDC? Are you going to the Department of Mental Health's website? Are you talking to your support coordinator and asking them for the most up-to-date information? But we also know you can go into the community. You can talk to your pharmacists, your schools, your senior centers, the things you do during your day, your dentists, your employers. That's a lot of other places we get our information. But we also know it's important to help people understand credible websites, credible news media, credible social media and blogs. So also trying to understand where maybe that information or misinformation might be coming from are also different strategies to support that conversation. But we also know if you want to stay up to date, check out most.covid.com for up-to-date information. You can also go to the Department of Mental Health Division of Developmental Disabilities website for a list of resources that would be helpful for you, or join them every Friday from 10:30 to 11:30 to find out what's happening currently. Or you can go to the Administration on Community Living's website for even more information about COVID-19. We hope this helps you think about how to stay safe and getting back to basics.
Well,
Thank you,
that worked out
Kat, for
okay.
sharing the video. And again, that's a resource, and we'll turn it over to Julie at this time.
Thank you. Well, it's better to have it at some point than the point we had it. So I'm glad you get that going. Thank you very much. I still can't advance my slides, Kim or Kat. Could you take me to the end? I want to talk just for a moment to all of you about some incentives. So what we want to do is we really want, I know I've seen in the chat some people talking about you've been educating for quite some time, but we want to offer support coordinators some incentive, to get out and use this toolkit that Leslie went through so wonderfully. There was so much there I didn't know, so that was kind of fun. But really to say, if you guys can get out there and do some education using this toolkit, also knowing what the individuals and families you work with, where they're at, and their thought processes and their feelings about kind of the getting back to basics and some education. We're going to provide through the No Wrong Door, UMKC-IHD is going to provide an incentive if support coordinators and TCM agencies are able to contact and document 30 or more individuals on their caseload that they have done education for us. We'd like you to document that in that IQMF ID, and I think I just got the acronym wrong, which is typical, that Carrie talked about. You all know what I'm talking about. So we are going to give your agency, based on the number of service coordinators, a monetary incentive, and really work with them to have that shared in some manner with support coordinators to just thank you for your efforts in this. We know what a difficult time it is right now, and this is all hard stuff to do, but I think it's important. So we just want to kind of encourage you by giving your agency something that we will ask them and talk with them and ask them to kind of like use that incentive money directly for support coordinators. And then Kat, if you can go to the next slide, we are able to do that with the contracted agencies. Unfortunately, since we are contracted with the state, we're not able to do that directly with state support coordinators. So the DMH, the Division of Developmental Disabilities, is going to recognize those regional office support coordinator teams with an incentive, for the documentation in the IQMFD. I don't know what I was when I said that. And again, it's the minimum of 30 individuals on your caseloads or that 85%. So either way, regardless of who you're working for, as far as a support coordinator, we really want to encourage you to get out, use that toolkit and whatever you need to pull from the sort of that toolbox that Leslie went over, and educate families and individuals about getting back to basics, about the importance of all the things we talked about, just to make sure that they are educated, and then you'll receive an incentive to do that will go directly to you all. So I think probably at this point, I don't know, we've got a few minutes. Kim, do you want to kind of go through some questions if there's anything out there?
Thank you, Julie. I believe we're going to turn it over to Carrie Williams to discuss some next steps. Thank you.
So next steps that I think Kim touched on earlier, but next steps that we're looking at is for the TCM tax to provide you with this COVID-19 toolkit. And as we have reviewed, that toolkit is that COVID-19 information and resources, one-page front and back document that Leslie reviewed in detail with us that includes all the various links. We'll also be sending out information, just some general information for how do you start that conversation. And again, remembering that really the emphasis is on, we're simply just sharing this information. It includes and is set up by resources, which are by category and type. And then we'll also share again, as it's noted within this PowerPoint, those steps for documenting in IQMFD as a positive outcome. So I just want to say thank you to everyone for joining today's presentation. This webinar will be posted on the division's website along with the Q&A document. And just a reminder too, to take a moment to answer the brief survey that will come up at the end of the presentation. And so thanks again and have a great day, everyone. Kim, I don't know if there's anything you would like to add?
I don't think so, Carrie. Thank you. You summarized great, and we appreciate everyone's participation today.
Just a reminder to everyone, the questions that you have put in the chat box will be compiled into a Q&A that will be posted.